Good evening. RCMP are asking for the public's help in finding two teenage First Nation girls who ran away from a group home in North Battleford last week. Now, 14-year-old Brianna Tawiaka is described as having a slim build and about 5 feet and 4 inches tall at 120 pounds. She was last seen wearing a pink hoodie, black yoga pants, dark green coat, black ankle boots, and a pink toque. Brianna is known to carry a square black and pink Adidas backpack. 13-year-old Chinoa Bird is described as 5 feet 3 inches tall with a medium build and about 137 pounds. She was last seen wearing a pink hoodie, black yoga pants, purple coat, and purple runners. Now, anyone with information is asked to call North Battleford RCMP at 306-446-1720 or Crime Stoppers. Meanwhile, a 24-year-old man from Saddle Lake, Alberta is facing a number of charges after being caught by St. Paul RCMP Thursday night for driving dangerously. While on patrol, RCMP attempted to stop a vehicle believed to be part of a break-and-enter in St. Paul in February where multiple handguns were stolen. Police say the driver, Leslie Gerald, didn't stop the vehicle and a long pursuit took place through Saddle Lake and St. Paul. The vehicle finally stopped on the south side of Saddle Lake where the driver and passenger ran into the bushes. They were found after a long foot chase. Leslie is facing break-and-enter charges, theft, failing to comply with probation, as well as many others. The passenger was released without charges. Alberta Health Services has confirmed a new case of measles in the Edmonton area. Health officials are warning passengers who arrived in Edmonton on a flight from Vancouver earlier this month that they may have been exposed to measles. Now, individuals on board Air Canada Flight 248, which departed Vancouver at 8:30 p.m. on April 9th and arrived in Edmonton at 9:35 p.m. may have been exposed. Also, those who were at the Edmonton International Airport on April 9 from 9:30 p.m. until 2 a.m. April 10th. AHS says those who have not had measles before or who have not received 2 doses of the measles vaccine should be on the lookout for symptoms. It includes a fever of 38.3 degrees Celsius or higher, cough, runny nose, and red eyes, and a red blotchy rash that appears 3 to 7 days after the fever starts. A new initiative to help curb fetal alcohol spectrum disorder began earlier this week. Liquor stores, restaurants, and bars in Alberta now have to display FASD prevention signs at their businesses. Customers will now be seeing more of these mandatory signs from the Alberta Gaming and Liquor Commission.
AGLC recognized an opportunity to support greater awareness and understanding of this issue and to bring the message that alcohol and pregnancies don't mix to places where liquor is sold and served.
I think it's just important to get awareness out there is the bottom line. The more that the people understand how much this can affect pregnancies and how it will affect upcoming generations is extremely important.
The AGLC says there are sanctions for failing to post the required signs, and inspectors will be working with businesses to make sure they are complying.
Sanctions range from warning for the first offense, $250 fine for the second offense, and $500 fine for the third offense.
According to the AGLC, an estimated 450 babies are born with the disorder every year. FASD has no cure and includes a wide range of disabilities related to permanent brain damage caused by alcohol. It's something we take for granted every day. Water is accessible at our every turn, but that isn't the case for everyone. Nearly 1 billion people don't have access to safe drinking water around the world, according to statistics from Watercan, a nonprofit organization dedicated to ending poverty in underdeveloped countries by providing them with clean drinking water. Anna Knopfate has more.
For us, it's as easy as turning on the tap.
In many developing countries, people don't have access to clean water or sanitation facilities.
For some, getting water is a daily struggle.
And anybody in an underdeveloped country, on average, has to walk 5 kilometers to get water, not clean water, just water to drink. Primarily, the organization Watercan helps people in Africa. I find that's where they find their most need. for clean water and clean water drinking sources, also latrines, things like that.
Thursday night was dedicated to the cause, collecting donations for Watercan. And for Scott McDonald, he feels strongly about the issue after traveling to Indonesia and seeing the problems firsthand.
A lot of poverty, a lot of shanty towns that share a stream of water, just a natural spring or whatever, and they use it for their bathroom and their drinking water as well. And it's very sad. Lots of children as well that have to live under those conditions.
He says it's not something that will be fixed overnight.
We transmit disease. If it's unclean water, you can transmit terrible diseases like Ebola, to each other. It's going to be a rising concern, I think, in the future with global warming as well. So.
But as Thackeray says, every little bit helps, and it's our duty to give since we come from a country rich with resources.
It's important to have Watercan coming from Canada, which is a well-off country, because I guess where else would the money come from?
The 5K walk is coming up in Lloydminster this week to raise funds for Watercan. For more information, visit iwalkforwater.ca. Anna Knopfate, Newcap News.